across the country. We are live on Western Region, Adwempa 100.7 FM in Takwa, Beach 105.5 FM in Takrade. In the Bunu region, you can find us on Green and 95.9 FM in Sunyang. In the Ashanti region, tune in to Adwempa 99.9 FM in Nkaria. In the Volta region, this is Heritage 107.3 FM Hohoi, Freedom 88.1 FM Sugakope. In the Northern region, this is Radio Gaki 88.3 FM in Saboba. In the Upper East region, Quality 88.7 FM in Garu. And in the Northeast region, Nobia FM 98.1 in Nalerigu. Please stay for details.
Citi Prime News at 12 midday. Update you on all the running stories and connect you to the newsmakers.
Grateful for your company. This afternoon will begin from Ejiso because voting has commenced across all 204 polling centres in the constituency to elect a replacement for the former Member of Parliament and Deputy Finance Minister John Kuma, who passed away on March 7, 2024. 6 persons, including 3 independent candidates, are contesting the much talked about by-election. Over 106,000 voters are expected to cast their ballots in this by-election. Notably, in former 3-time Member of Parliament for the constituency on the ticket of the New Patriotic Party, Kwabena Osu-Ediomi, who is now running as an independent candidate. Now, despite allegations and accusations of betrayal, Kwabena Osu-Ediomi is optimistic of winning the by-election. But let's touch base with our Ashanti regional correspondent, Hafiz Tijani, who's on grounds for us. Good afternoon, Hafiz. Talk to us about the voting so far. How has things been?
So the numbers were encouraging across some of the centers in the morning, except that now the numbers are declining. And you go to some centers, you just find only the Electoral Commission officers seated and waiting for the electors to turn up at the various centers to vote. Even before the start of polls at most of the centers, you could see that people were joining the queues to probably vote early and leave the center. But as the day goes by, that is not what you find in when you go to most of the centers. The numbers are the queues are empty, and the numbers are not so encouraging at most of the centers too. So, have you
been able to speak to some of the electorate, and are they saying that they have a specific time for which they are waiting to troop into the voting centers?
Well, so for most of them who came in the morning, they said they wanted to vote and leave the place and go and continue with their daily activities. Others said that they had to go and then attend to their businesses before they can come and vote, since the time of the close of poll would be 5 p.m. So they will be coming back close to that time to cast their ballot. But you don't find a specific reason attached to the low numbers that is being recorded here. At some of the centers, you find people coming in one by one. One person will just come in and then cast their ballot and move away. But you don't find people forming queue as the case was in the morning when people were turning up at the various centers, even waiting for the electoral officers to set up their materials for them to go through the process.
Right.
So that is what you find currently at most of the centers.
And voting is ending at 5 p.m., correct?
Exactly, Ajwa.
So have you cited any of the contenders, and what is their mood ahead of the declaration of results, maybe after 5 p.m.?
So we have been told that Mr. Kwabena Osu-Ediomi, who is contesting in this election as an independent candidate, will be voting at the Bisianse Sakura Park polling center. And we have not had him come yet to vote. We were told by his campaign team that he is also monitoring the events at some of the polling centers and also visiting his agents to ensure that they carry out their duties accordingly. And we are also told that lawyer Kwabena Boateng, who is the MPP's candidate, will also be voting at Onye, and he has not also gone to that place to vote yet. So we're still monitoring the voting times of these contestants. These are the two main contenders in this election, and the focus has been on the MPP's candidate and also the independent candidate, Mr. Idiomi, who has been a former member of parliament for this area.
All right. Thank you so much, Hafiz Tijani. Clearly, you have a lot to do today. We'll leave you to follow the process. Hafiz Tijani is our Ashanti regional correspondent, and he was giving us updates as far as the Jisoba election is concerned. Let's move away from that topic now, because the minority in parliament is asking the chief of staff, Akosua Fremo Seopare, to revoke any supposed directive given to the minister designate to begin acting as ministers without parliamentary approval. Parliament in March this year suspended the approval of President Akufo-Addo's new ministers and deputies who were vetted by the Appointments Committee following an injunction filed against the process by South Dai MP Roxy Nelson Dafiamepo. Now, despite the non-approval, a purported creation of new appointment by the Chief of Staff has given the green light to the ministers to act as the President's representatives in their respective ministries. This, the minority in Parliament believes, is illegal and a breach of the 1992 Constitution. Kwabena Minta Kando is ranking member on the Health Committee of Parliament.
This country is a national republic. It's governed by rules and regulations, by the Constitution of the Republic of Ghana. And the law is clear that if you appoint a minister, the president should appoint a minister. Let me refer you to Article 78(1). If the president appoints a minister, he must have prior approval by Parliament before the minister is sworn in and subsequently represent the president at that particular ministry. So that is the process. And these people have been nominated and vetted. They have not been approved by Parliament. So there's no way they can hold themselves as ministers and go and disrupt activities of public servants. And so I think that we must respect the laws of the country. The president is the first gentleman of the nation, and he owes it as a duty to protect the Constitution of the Republic of Ghana. And so I think as a matter of urgency, he must call the Chief of Staff to order. There is no such position, there is no such creation in the Constitution of the Republic of Ghana, the 1992 Constitution. And so it's clearly illegal. It's alien to the laws of Ghana. You don't take illegal orders. As I speak to you now, if you tell me to go and kill, or I tell you to go and kill because I'm giving you orders, you also go and kill. So you don't say because a higher authority has given me illegal instructions, I will have to obey it. If you don't do that, you will not be a good citizen. Law-abiding citizens do not obey illegal orders.
You heard the ranking member on the Health Committee of Parliament and member of Parliament for Joaboso Kwabena Minta Kando. Away from that, the Minister of Health designate, Dr. Bernard Okoboy, has assured that the government is committed to resolving the power situation at the Korle Bu Teaching Hospital. This follows media reports on Monday, April 29, indicating that critical surgeries were cancelled due to the ongoing power crisis. A press statement issued by the management of the hospital today, however, denied the report but attributed the issue to low voltage. Now, speaking on the Citi Breakfast Show, Dr. Okoboy said he was at the Korle Bu Teaching Hospital yesterday and preferred possible alternatives to the current power challenge.
Korle Bu is not like LECMA, which has only one genset. The plastics unit, which is a whole hospital on its own, has its own genset. PICU, Pediatric Intensive Care Unit, has its own genset. Central the theater has its own genset. The CEO has informed me that all the units that operate in Korle Bu have gensets. Those who have issues with their gensets, they are working to make sure that they help them to put it up to speed. The point I'll make on your show is that as a ministry, we shall work with the management of all public facilities to make sure that their standby plans are functional and up to date. Anytime they are needed, when called upon, they can function. That is the assurance I give. All this while, anytime you see power outage in Korle Bu, they don't close the hospital down. They put on their plans. They buy fuel themselves. Korle Bu has a management. They have a board. They have ITF. They raise funds. They manage their facility. We are working with them to make sure that they help Ghanaians anytime they need their help.
That was the Minister of Health designate Dr. Bernard Okoboy. Let's stay a while longer on the issue of power outages and its impact on health facilities, because managers of various health facilities in the Eastern Regional Capital, Koforidua, are appealing to the government and the Ministry of Energy to address the recent erratic power situation to help reduce a surge in operational costs. According to them, aside from spending a lot on money on fuel to power their plants, which are often unreliable, essential medicines and vaccines are also going waste. Some facility managers who spoke to City News confirmed their inability to transfer the additional operational costs to clients and patients despite struggling to manage the extra expenses. The managing director of the Koforidua Clinic, John Afeji-Apia, and the medical director for CDC Hospital, Dr. Damien Akwete, have shared their thoughts on how the recent power outages are affecting the operations in the health sector.
Most of the services we render to our clients are based on electricity, in the sense that all our systems are automated and we're working on a digital platform that allows us to be able to render quality and efficient services to our clients. So anytime there's a power outage, it brings the whole clinic to a halt. Thankfully, we have a power plant which we use, but again, the power plant, in my opinion, is supposed to be a backup. But in the case where power goes out for a very long time, then it becomes like the main source of power. And of course, that is not the ideal situation. So it is also going in a long way to affect some of the equipment we are using, some of the machines we are using. And then the matter of cost is something that we cannot hide, because we need to make sure that the plant is well serviced, and then we need to buy fuel. Now that the fuel prices have gone up, it has greatly affected our finances, in the sense that we have to always ensure that at least we have enough fuel in the power plant, and then the power plant is efficient and running.
Production cost, it's much higher now because we need to fuel our plant so we can have our machines running. We need to keep our drugs in certain drugs in refrigerator and they maintain certain temperatures. So in general, production cost it's gone up a bit, but we are managing. Definitely we are worried, but we hope that government in collaboration with stakeholders will be able to overcome this in due course, and they will revert back to normalcy.
You heard the managing director of the Koforidua Clinic, John Afeji-Apia, and the medical director for CDC Hospital, Dr. Damien Akwete. Away from that, the Ghana National Fire Service has warned the general public to ensure safe use of generators and power plants as alternative to electricity. This follows the increase in use of generators as alternative power source amidst the ongoing erratic power supply. In an interview with City News, Director of Public Relations for the Ghana National Fire Service, ACFO1, Timothy Osafo-Efum, explained the risk involved in the use of generator and highlighted safety precautions.
The use of generator comes with two forms of risk. The first risk is that the generator must not be put indoors because it produces carbon monoxide. That is the fume that comes out, is composed of carbon monoxide mostly. People tend to refuel the generator while the generator is being powered, and that has a high risk of causing fire outbreak. So these are the two risks associated with the use of generators. So one, we advise that the generator is placed outside in the open so that whatever fumes is generated is dispersed in the atmosphere. Then the second one is that if the fuel in the generator is exhausted, please turn off the generator, refuel before you restart the generator so that you don't cause any fire within your premises.
That was the Director of Public Relations at the Ghana National Fire Service, ACFO1, Timothy Osafo-Efum. You're still listening to the Citi Prime News live from our studio in Adabraka, Accra. Still ahead, Citi TV and Citi FM's annual family consecration service camps of tomorrow. Please stay for details.
Citi Prime News at 12 midday. Update you on all the running stories and connects you to the newsmakers.
Citi TV is live on DSTV, GoTV, and HD+. On DSTV, find us on channel 363. On GoTV, we're on channel 117, and on HD+, get us on channel 108. On a digital TV, run a new search, but take note that without an antenna, you cannot access Citi TV. Citi TV can be accessed on any free-to-air digital box like the GoTV and HD+ boxes. Citi TV, it's your world. Another year is here, and your family radio station 97.3 Citi FM, as part of our Family Month, invites you to the 2024 edition of the Family Consecration Service. Join us as we invite His presence and His blessings and dedicate our lives and our homes to God. Now, through prayer, scripture reading, and a time of worship, we will deepen our relationship with God and strengthen the love within our families. The date is Wednesday, 1st May 2024. The time is 6 a.m. right through till 12 noon. The venue is the Oil Dome Royal House Chapel, Accra. There will also be a time for the renewal of vows for married couples. The 2024 Family Consecration Service is powered by 97.3 Citi FM and supported by Citi TV. Remember, the family that prays together stays together.
Citi Prime News at 12 midday. Update you on all the running stories and connect you to the newsmakers.
You're welcome back. Let's give you some more stories. A political science lecturer at the University of Ghana, Professor Ransford Jampo, has expressed concerns about the free senior high school policy, stating that it does not adequately promote quality education in its current form. He suggested that modifying the policy to target brilliant but needy students would help alleviate the financial burden on the government while ensuring quality education. Professor Jampo made these remarks during the launch of the Relief and Aid International Educational Scholarship in Accra.
Government is trying to provide free education to everybody, free SHS to everybody, but it knows it hasn't got the resources to do it. But because we have promised that we'll do it at all costs. Whether we can't do it or we can do it, we'll still do it. That does not promote quality education.
You heard a political science lecturer at the University of Ghana, Professor Ransford Jampo. Now, a founding member of the New Patriotic Party, Dr. Nyahu Tamaklo, on his part, says the recent allegations of rot at the Scholarship Secretariat suggest that integrity in Ghana is at its lowest level.
We have seen quite a lot in this country. Normally, scholarships are meant for the needy. I went to university with scholarship. I went to secondary school with scholarship. I schooled with scholarship. But now, scholarship meant for the needy are given those who have rather got it. It tells you integrity is at its lowest level in Ghana at the moment.
Dr. Nyahu Tamaklo is a founding member of the New Patriotic Party. Let's stay on education because the West African Examination Council, WAEC, has rejected claims that its operations will be stifled if private schools decide not to partake in next year's Basic Education Certificate Examination, BEC. This comment follows a threat by the Ghana National Association of Private Schools to mobilize its members to boycott next year's BEC should WAEC arbitrarily increase its registration fees without engaging them. In an interview with City News, WAEC's public relations officer John Cappy stated that while his outfit cannot solely be held responsible for fee increases, it is willing to engage leadership of the association.
It's not the case that the private schools are the ones funding activities of the WAEC. Yes, of course, they pay examination fees, but you pay fees just for the examination that we are going to conduct for you. And so if the fees are not paid, no exam will be conducted. But remember that government is a major stakeholder when it comes to the writing of this examination. And government will always ensure they make appropriate financial provision for it. Now remember that when we say government owes us, that does not mean that no provision has been made for one thing or another. There probably may be some shortfalls in one area or another. And so if the Association of Private Schools choose to pull out, all we have is a reduced, candidature, and therefore a reduced budget, and we'll be able to go along, to run our operations.
That was a public relations officer for the West African Examination Council, WAEC, John Cappy. Let's take you to the northern region now. The Nanumba North Municipal Health Directorate has raised concerns over a rise in waterborne diseases, especially typhoid cases in the municipality, attributing it to the lack of potable water for consumption. According to the Health Directorate, water is rationed as a result of a water crisis in the municipality, compelling residents to rely on water bodies in the community for drinking and other domestic purposes. Citi News spoke with Francis Atiagbo, the Municipal Director for Health in Nanumba North Municipality, and he had this to say.
From our reports, we realized there has been an increase in typhoid cases, including typhoid perforations at the municipal hospital. And generally, there is water rationing quality, especially in the Bimbila township. And so when people are not getting water, most of the time they depend on the dam water for cooking, washing, and other things, and even including drinking. So that is the source of most of the infections. And the other facilities to some of the communities, they also don't have pipe-borne water, and so they also depend on the dam. And during the rainy season, as the rains have started like this, most of the time the water will wash to the dam, and they continue using the water.
Well, Francis Atiagbo also mentioned some measures taken by his outfit to curb the menace and called for government intervention.
We have also gone to those communities to sensitize them on the importance of making sure that when they even fed the dam water, they boil the water before they drink. And then we have also been working with the environmental unit of the municipality, always monitor those dams to make sure that sanitation in the communities is improved. We've also done community engagement in those areas that most of the cases are coming from, like Chamba area, and then also some other communities. Those are the areas that most of the typhoid perforation we recorded at the Bimila Hospital are coming from. So when we look at the data, we realize these are the areas the cases are coming from. We've gone to those communities together with the presiding member and assemblymen in the area to talk to the people about the need to make sure that their water boils. The government is a municipal assembly. Maybe what they need to come out with bylaws as to how to the dam water and make it eligible for the, and also they should bring more boreholes and mechanize them so that the communities can get potable water.
Francis Atiagbo is the Municipal Director of Health in Nanumba North Municipality of the Northern Region. Now, the reported decision by food delivery company Glovo to cease operations in Ghana has sparked concerns among delivery riders who rely on the platform for their livelihoods. The decision comes despite Glovo's significant investment over the past 2 years to bolster its presence and services in Ghana. In an email sent to restaurant partners, the company cited profitability issues encountered within the Ghanaian market as a primary reason for its exit. Speaking to Citi News, some riders expressed worry over the potential challenges in finding alternative source of income.
Actually, Glovo stopping their company is going to affect us a lot. But we, the youth coming up, we need something to stand on as a youth to, build a foundation for ourselves. But realize the case, both Glovo is stopping. It can affect our endings as a boat rider as well.
Delivering has been good to us because there is no job in a system, that's in the country. Okay, so them saying that they are going off or they are not going to work anymore, it's going to affect the youths on the streets. You understand? It's going to affect the youth very, very well. And though we have so many deliveries, but the Glovo and boats are the people who would support us in certain things.
It was so hardest night for many of the riders. Some of them we are weak because some of the riders are having only Glovo app, and that's what they're based on. So while some are having both app and Glovo, even some are having Yango. So what it means as Glovo is folding in Ghana, it will cause a lot of unemployment in Ghana because many youths are depending on it to survive and to feed their family.
Those were some riders of Glovo expressing worry about the potential decision by the company to relocate to other countries because of cost operations. Let's move away from that. And President Akufo-Addo has urged African leaders to join forces in combating illegal activities along the continent's shorelines. He emphasized the urgent need for coordinated efforts and shared responsibility in addressing maritime security challenges across Africa. Delivering his keynote address at the inauguration of the second annual African Maritime Forces Summit and the third Naval Infantry Leaders Symposium Africa in Accra, the president advocated for increased joint exercises among African navies to confront existing threats and enhance maritime awareness along the shorelines.
There are increasing numbers of other incidents occurring in the territorial and international waters across the entire African continent. Illegal oil bunkering, kidnapping at sea for ransom, illegal fishing, terrorism, and drug trafficking are common threats across our territorial waters. These transnational crimes do not only threaten national and regional peace and security, but they also come at a great cost to the economies of both coastal and non-coastal states. In the face of these challenges, it is imperative that we foster greater cooperation and collaboration amongst African maritime forces. By working together, sharing intelligence, and coordinating our efforts, we can address effectively maritime security threats and safeguard our maritime domain.
President Akufo-Addo speaking. Away from that, the National Petroleum Authority, NPA, says it is committed to helping reduce the operational cost of liquefied petroleum gas LPG marketers. This assurance follows concerns raised by the Marketers Association regarding the introduction of an $80 per metric ton charge as part of the supplier's premium, specifically designated for bottling plant and cylinder investment margins. Abbas Ibrahim Tasunti, head of economic regulation at the NPA, has been speaking to Citi News.
Taxes are what usually generate revenue for government. So if government can generate taxes from elsewhere, then they can consider reducing some of the taxes on a particular product or service. And that's the appeal we are making. The other thing NPA has done, whilst waiting for government to respond to the call for reduction of taxes, is to find a way to introduce innovative ways to reduce the cost of LPG. So what did we do? Last year, we started discussing with the BDCs that if you look at the way we used to import LPG, we have different BDCs importing LPG in smaller quantities, and it was more expensive.
Abbas Ibrahim Tasunti is head of economic regulation at the National Petroleum Authority. Now, Citi TV and Citi FM's annual family consecration service will be happening live tomorrow, May 1, 2024, at the Oil Dome Royal House Chapel in Kaneshie. The much anticipated 6-hour event aims to unite families from all corners of Ghana in prayer, seeking divine guidance, protection, and blessings for the rest of the year. Starting at 6 a.m. and ending at 12 noon, the 6-hour-long service promises a spiritually enhancing and enriching experience for attendees. Leading the family consecration service will be the esteemed pastoral team at Citi FM and Citi TV, led by Reverend Dr. Stephen Wengam, who has been speaking ahead of the event tomorrow.
If you look at the way God works, expectations is crucial. God exceeds our expectation, not just expectation, high expectation. So come knowing, believing, trusting that God will do far more than Ephesians 3 verse 20. And again, we'll be dealing with issues like bloodline issues, family curses, family altars. We'll be praying for singles, we'll be praying for single parents, and name it. So we'll cover family health. So a family member is sick, come, bring them along, and like we said, come expect and know and believe in. You hear testimonies. Many have named their children. You know, one guy said wanted to name the son Citi FM. I said, I don't like critical. So tomorrow heavens will come down.
Amen.
You see all kinds of people. You will see politicians there. You will see businessmen and women. They come, and one thing I like about the people come, and they don't come to loiter around. Everybody's serious. Everybody's serious. And exactly 12 we closed.
Reverend Stephen Wengam is General Superintendent of the Assemblies of God, Ghana. We'd want to see you all at the family consecration service. But that's how we wrap up today's edition of the Citi Prime News, which has been live from our studio in Adabraka, Accra. For more stories, please log on to citinewsroom.com. My name is Ajwa Tinkrama. Thank you so much for listening. Good afternoon.
Citi News. We speak first. Reach our hotline on 0302 224959 and get interactive.